Hi, this is Dr. Kathy. Today I'm talking through with you how I do a trial of stimulant medication, the short acting. Now, this will apply to the dexamphetamine short acting or the methylphenidate short acting. Now, methylphenidate now has three brands in Australia. There's Ritalin 10, there's Artige, and there's RInidate. The big difference is RInidate does not contain wheat. And so if your child has celiac disease or wheat allergy, you definitely want that brand. Otherwise, with the overwhelming majority of people, it doesn't make a difference. So when I recommend a trial of medication, I'll give you written instructions and they'll look something like this. Now, both dexamphetamine and methylphenidate, aka Ritalin 10, come in tablets, and it's just the way it's worked out that it's the same number of tablets of either for the same weight. So it's weight-based dosing. Now, I'm showing you something for a child that's roughly 25 kilos, and I'll talk you through, but this amount of tablets might not apply to your child. Please refer to what's on the script and the written instructions I've given you. So basically the rules are we have a single dose in the morning after or with breakfast. Now, if I'm seeing a child in the morning and they're home with their parent for lunch, then sometimes I recommend the first dose be at home with their parent for lunch. But I usually recommend starting in the morning after or with breakfast. Now, I prefer that the child's home with you when they have their first dose or first dose increase, and that's so you see what's going on. Crucial thing is we don't give it with any source of vitamins, fruit juice, multivitamins, etc., because vitamin C affects absorption. So we start with a quarter of a tablet for a minimum of 3 days. Now, I've put 3 to 14, and the crucial thing is that if it's doing nothing after 3 doses, if they're at home with you, put it up. If you need to wait a full 7 so that they're home again on the weekend, then wait 7 days. If you're starting to see benefit and you're not sure, then go for a whole 2 weeks. If you need to, you can go to half a tablet, again, minimum of 3 doses. If you need to, 3/4. If you need to, 1, 1/4, 1.5. Now, crucially, more does not make it last longer. Short acting lasts roughly the same length of time. It will give more of an effect. It might last maybe 5 or 10 minutes longer, maybe 15, but not substantially. Now, people ask me, what is it for? And what you've got on page 2 is some blank forms. Now, I'm going to show you someone else's forms that are being completed. So this is a 20-kilo child before medication at school. Everything in these questionnaires is ADHD. So this is all this child's level of ADHD. Now, at school, after half a tablet, it brought it down to the child sometimes getting it wrong. Now, this is a 6-year-old boy. He should sometimes get it wrong, but it's quite a significant difference. Crucially, I don't want never or rarely. That's too flat. That's the so-called zombie. And then I've got here a 30-kilo child before medication at school. Same child, half a tablet and 1 tablet averaging 1s. This has all been at school. Now, then at home before medication, half a tablet and 1. And you can see at home, 1 tablet appears to be the right amount. And at school, 1 tablet appears to be the right amount. The teacher has written on the bottom of the half a tablet some comments, and it says behaviour changes between 8:50 and 11 and 11 and 3. Now, had the teacher read the front page where it says, Dear Teacher, it says it's going to do that, but the teacher did document it. The crucial thing is when this is in paper, this comment sits above the 1 tablet because it's stapled together. So these blank forms that I'm giving you are for you to complete. You don't have to fill them out. The school doesn't have to fill them out, but most people find them helpful. So they've got a sense of, well, how are they going? Especially where there's shared care, it's really good for the school to be showing what is the What is the child like at school? So that's what all these pages are about. Now, the crucial thing with this one is on the a quarter and again on the half, I've put 2 strengths. There's a lot of paper and I really don't like killing trees. So my suggestion is you use a different colour pen if you get all the way up to the second dose. Usually if a quarter of a tablet is starting to do something, then you're not going to go up as much as 1 1/4. And if they need 1 1/4, then a quarter of a tablet's not going to do anything. So that's the purpose of that. And then I've put down the potential for side effects. Well, too much makes a child too flat. As I've said, I don't want all zeros. It does reduce eating, and I've got to keep an eye on height and weight. There can be motor and even vocal tics. The child can get emotional, and I need to explain this because this is a little bit complicated. I have had one boy in tears, 5-year-old boy. First dose was at home on a weekend, and they're going down the street and he's got tears streaming down his face because finally he could read everything. I know, how beautiful. And one girl, she was upset because finally she's able to focus in class, and she realised the child she thought was a friend was actually a bully and was trying to provoke her into an outburst, and she was so upset. And one girl, she got angry with her brother and sister because finally she could hold on to a thought, and then she could hold on to a grudge, and she had to learn how to forgive. Now, that's not what we're talking about. We're just talking about grumpy, moody, weepy, especially as it wears off, but it can be during the day. So that's not an okay side effect. Now, it can also cause nausea, diarrhea, tummy pains like gastro. Stop it. Is it him? Is it everybody? If you're not sure and it was a mild response, then you might want to retry. There aren't ADHD medications, so I'd be careful about dismissing something too easily. I have had a couple of brief heart palpitations, and if your child gets heart palpitations, please call the ambulance. They can do an ECG tracing in the moment. Please don't leave it. I've also had dry mouth and very rarely leg spasm. Now, when we're doing a trial of short-acting medication, we need to get that morning dose right. For many children, they don't need a second dose. You can give a second dose at home if you think they need it, but a child can't have it at school until I have certain information. Now, in order to try that second dose, I need to know how much they're having in the morning, how much they're having at lunchtime, and what time. I can't write lunchtime on the forms. This is in part because schools have switched break around, and we're now talking about first break and second break. And I really prefer a child has their second dose towards the end of a break time. Then they've had a chance to eat and it's not interrupting lessons. I'm happy to do this, and I usually will give you enough until that next appointment, but that's the information I need. So I hope that's a helpful discussion on how I do a trial. Please don't forget to look at the forms I give you because they've got all this in writing. Have a great day.